Hi, my name is Erin Schmidt, and I'm working with Us Together this summer as a Vista Health Associate. And my role this summer is to help educate the refugee and immigrant population about the COVID-19 vaccine, as well as work with the community and different health providers to educate the different barriers that they face in receiving the vaccine. And so I came into this project without really much information or knowledge about refugees or immigrants, and even much of an interest, honestly. And I was originally looking into this to get experience in public health, but as I started working here, in May, I immediately started developing a passion for refugee immigrants and it started just doing outside research and watching different documentaries of different populations and their experience. And so, when I would interact with refugees or immigrants, I really didn't stop to consider some of the struggles and just tragedies they had gone through to get to this country. And my heart broke learning about the utter atrocities of violence against women, the barely livable conditions in the refugee camps, the fact that people can live up to 17 years in the refugee camps if they happen to even come to the country, and also just the constant fear and threat of violence from their home countries. And so I then in my probably Western centric and uninformed mindset, even coming into this, I had this idea that refugees would all of a sudden have this great life because we're in America and it's a lot better than where they're coming from. But the truth is, there are a lot of struggles that come with this, and they're different, but they're still really hard to process and to deal with. So I I just soon became aware of these experiences. And so it's been a privilege to be able to share some light about this and to just share some of the struggles that refugees and immigrants are experiencing and to help alleviate these issues in some form or fashion. And so I'm here today to give a little overview of the information I've gathered from research and talking with people in the communities um, about the vaccine and just share some stories about just different ways that we can these barriers. And so first, the contributors to this presentation. And so I was able to work with some of these people to get an insight or to get a perspective on the COVID-19 vaccine. And so I talked with Dennis Casaza, and he is one of the clients at Us Together, and he's from the Democratic Republic of Congo. And we had a really interesting conversation. I'm excited to share more about him. And I also talked to Hannah Abdelbaki, and she is the program coordinator for victims of crime at Us Together. And I also interviewed Mike Primo, and Mike Primo is the director of engagement for community development for all people, and it's a faith-based nonprofit on the south side of Columbus off Parsons Avenue. And I interviewed him because he had a vaccine clinic come to his building, and I felt that this could be a really good thing for some refugee and immigrant communities. So first, in a little overview, I will talk about the urgency of the vaccine for refugee and immigrant communities, some of the barriers that they face in receiving the vaccine, and just information on how to overcome and reduce those barriers. So first, vaccine urgency. First of all, refugees and immigrants, especially refugees, can be vulnerable to the serious and complicated side effects from COVID-19. One, mental health. A lot of refugees and immigrants come with mental health problems due to the rough conditions of their homeland, as well as the conditions in the refugee camps and the loss and trauma and unhygienic complications that come along with that. And so COVID-19, there's a lot of mental health struggles with that, and so they're just kind of compounded with refugee experience, as well as the physical complications. And so the refugees live in damp and poor sanitary conditions, as well as there's smoke from open fires, and these are all risk factors respiratory complications, lung cancer, and cardiovascular disease. And so when these things happen, and if refugee with these conditions get infected with COVID, it can be really, really difficult for them. And one thing, they are actually less likely to go to the doctor. And I got this information from Hannah. She was kind of sharing some of her experiences because a lot of refugees, they're not used to going to the doctor, especially in the camps. There's no resources for that. And so they're not inclined to go to the doctor and learn more about the vaccine and learn how to be treated and so forth. So I thought that was really interesting. And it's something that I think we need to be aware of. So even if refugees go to get medical care, it will be difficult to do so. Well, insurance. So after refugees come to the U.S., they are given short-term insurance, but it will eventually phase out, and so a lot of them are left uninsured as well as immigrants, and so they're less likely to be able to get care. And transportation, these populations generally don't have access to a car, and so it's difficult to get to their appointments and so forth. And if they're not eligible for Medicare, they can't get free medical transportation. And they also have just overall trouble with navigating the health system. The health system in general is very complicated, and it's even more complicated for the refugee immigrant because it's very different from their home country. And even the idea of insurance is different because a lot of them receive free health care and don't have to deal with insurance. And so, some additional concerns, um, the living conditions. So a lot of refugee and immigrants come from big families that are all in one household, and so there's pretty small proximity to people, and so they're more likely to be spread with coronavirus, and it's hard to isolate one another. Increased exposure sometimes to COVID because a lot of these workers are essential workers, and so they're ultimately going to be around more people in factories and so forth. So, and then there's also a lack of paid sick leave, and so when they don't have paid sick leave, they're more likely to stay at work even when they are infected or exposed to someone with COVID. So that can obviously lead to problems. And so different barriers. Um, One, culture and religion, fear and lack of trust, misinformation, transportation, and language concerns. So another factor is culture and religion. So I had an interesting conversation with Hannah, and she was sharing about how one of her clients was Muslim and she wore the full Islamic clothing. And so she was really uncomfortable showing her skin to get the vaccination. And she went to the Ohio Expo Center where it was a drive up clinic and it was very open. And they eventually found just ways to bring more privacy, but it was really difficult. And fortunately, people can get their vaccination in doctors and pharmacy locations, but that was definitely an issue at first. So another thing is fear and lack of trust. It was interesting talking to Dennis, and also kind of sad. He was sharing how a lot of his African friends were just kind of afraid of the virus or afraid of the vaccine because in the past Africans have been experimented on and have died from different vaccines in their countries, and so they worried that this could be the same with the COVID-19 vaccine, and so they picked a lot of that up from social media, and so it was really interesting and something that we need to be aware of. So misinformation, and so this kind of ties back to what I was sharing about with Dennis, but a lot of refugees and immigrants, especially, use social media to communicate with their family and their relatives from back home. And so, if this information from their home countries, news sources, and so forth is false, that this information can be spread. And then there's just an overall lack of education about the COVID-19 vaccine among these populations, and even um, in the country as a whole, but especially where English is not a primary language and people are just not as educated in general. And so transportation, as I mentioned before, people have struggled with getting transportation for medical appointments, and so that's the same with a vaccine because they may not have reliable transportation. So language concerns, there can be a lack of translated accurate resources, and without translated materials, misinformation again can be spread more easily. And also, people won't know how to get resources, how to get care if there's not accurate translated material. So, overcoming and reducing barriers, there are various things that I've come up with based on my conversations and outside research. So, I'll just go ahead and start. So, community vaccine pop up clinics, Columbus has done a really good job in trying to erase some of those disparities and help get everybody vaccinated. So, um, organizations can call Columbus Public Health, and a clinic can come to their location. And it's very, doesn't require a lot of staff and limited time commitment, and you just have to have the space to do it. So, it's a convenient way and it helps reduce those transportation barriers. And I was talking to Mike, and he's gave me some of these thoughts, and he was just sharing how it really leveraged that community trust that the vaccines were safe and effective. Because if people are coming to his organization already where they provide resources and there's that trust built, and so when a vaccine is there and everybody's saying that it's safe, people are more likely to take it in an environment that's really comfortable for them. So another thing that's really important is just for other refugees and immigrants and other people to share their experiences about the vaccine, and that it is safe and that people, yeah, want to take it and it's good. And so as people, in the community kind of see that it's good, people will more likely want to take it. And something cool that I talked to Dennis about, he's actually going to all of his friends' houses and family to just share about the vaccine and that he's alive and safe and that it went well. He also even brought one of his white colleagues with his black friend to the vaccine clinic to show that, not this vaccine's for everyone. It's not just for black people. And that was really, really cool idea and something I think was very effective. So another thing, encouragement from trusted organizations. Talk about this a little before, but these are some pictures of us together. And Hannah was just sharing that because she has these established relationships with her clients because they've, talked about different personal things and private information and built this trust over the years. They're more likely to listen to her. And so when she shared that she took the vaccine, her kids took it, and that it's been safe and effective, they're more likely to take it. And Mike has found this as well. He was sharing that there was a woman herself still hadn't taken it, but the church members shared that there was a vaccine clinic and that she should get it. That was all that she needed. She showed up an hour early to the appointment and was excited to get it. So I think that is definitely a good thing. And so one thing I talked to Mike about, just the government and community working together on this because the communities have to advocate for themselves, and in order for government entities and public health institutions to know what the community needs. At the same time, these partnerships need to be built and these relationships need to be built over time for the 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 government to be more likely to address these needs. Something also is culturally sensitive translated material. And so one of my projects this summer was creating these booklets that have been translated into various languages. And they go over the benefits, effectiveness, safety, the different vaccines, effects, and transportation, and where to get the vaccine, and other resources to make it easy for refugees to get this information and that it's coming from a trusted source. And so, if you're interested, you are more than welcome to spread those out in your community, and I will share later how you can do that, how you can get that information. And then finally, just overall cultural awareness. I think it's really important to be compassionate and listen to people's concerns because refugees and immigrants can just carry baggage and different cultural and religious things that we may not be able to relate to or understand. And it's really important to just be patient and to just listen, continue to have conversations, but not force anything because sometimes they just need time to research on their own and talk to people in their community and so forth. So, and that's it. Thank you so much. If you have any other questions or want additional information or those resources like I talked about, you can email Kristina Brooks at Kbrooks at ustogether.us or visit www.ustogether.us. Thanks again. It was really, really great. And I hope this has been just beneficial and useful to whatever capacity that you're in. Thank you so much.